Good morning and welcome back. You are watching Tampa Bay's Morning Blend. And this morning we are continuing, obviously, our conversation with COVID-19 and how it is actually affecting cancer patients. And this morning we are happy to bring in from the Moffitt Cancer Center, Dr. Green. And there is a lot to talk about here. And I know our show really hasn't kind of dived into this yet. So I'm so happy you're joining us, Doctor.
Thank you so much for having me. Really appreciate being here.
Yeah, I think this is so important when we talk about who is kind of most at risk for COVID-19 complications and who we really need to kind of be focused on. I have been thinking about cancer patients a lot, and I know this is what you and your team do year round, day in, day out anyways, but give us a little bit of an update on what Moffitt Cancer Center, how have you guys been operating here recently?
Absolutely. As we all can imagine, most of our cancer patients in the community are concerned, just like everybody else, with regards to having some type of treatment during this COVID-19 pandemic. And rightfully so. I think all of us are concerned about going into any setting where there could be an increased risk of exposure to COVID-19. But one of the things that we want to say to our cancer patients and to the community is that Moffitt is probably one of the safest places that you can be with regards to getting your cancer care. And we are, certainly very vigilant about making sure that we create an environment where our cancer patients are absolutely safe. So we put several measures in place, like many other healthcare facilities, such as, we limit the number of people who are on campus. So we have about 40%, believe it or not, of our workforce who are working from home. So again, that limits the number of people who are on campus. We've also limited visitors, actually have a no visitors policy in place. And we only have visitors in cases where it could be an end of life situation or some extreme circumstances where a family member needs to be with with the patient. We also have mandatory screenings at the entrances for both our patients as well as our team members. Of course, we want folks wearing their masks, particularly when they're in patient care areas. So that's mandatory. We make sure that everything is properly cleaned and sanitized, particularly in the patient care areas, just creating an environment where we can also do the social distancing. So we have all those measures in place so that our patients can feel safe. Absolutely.
And when it comes to cancer, doctor, I feel like timing is so critical, both in treatment and diagnosis. So what is your message for families watching today and making sure that they get the care and the screenings that are needed in a timely manner?
Absolutely. That's a great question because just like any other procedure, many of our folks in the community may say, you know what, I'm going to put that, prostate screening off another 2 or 3 months, or I'm going to put my colonoscopy off for several months or what have you. And what we encourage people to do is to make sure that they get that screening as soon as they possibly can. Because I think we all know that the earlier we can detect the cancer, the better the outcome. Because the last thing we want is for someone to present to the cancer center with a late diagnosis of a cancer. Because as you can imagine, the outcomes can be much worse as opposed to us finding it as quickly as we possibly can. And so we are really encouraging folks to get those screenings, and maybe they could be put off for a week or two or what have you. But as soon as you can get that screening, the better. The other thing I would advise is, maybe just call your physician and ask him or her, when it's safe for you to come in to get that screening. But I would not just sort of put it on a shelf and say, hey, I'm going to wait until this COVID-19 pandemic is over, and then I'll go in and get my cancer screening. That's not what we are recommending.
Before we run out of time, I know you also wanted to mention how this is affecting minorities and those with disparities. Talk about that segment of population and why it's really, really crucial that we are making sure that the word is getting out to them just as much as everybody else.
Absolutely. So I am not surprised that we're seeing the disparities in COVID-19 with African Americans and other minorities, because health disparities is one of the areas that I've studied for many, many years. And many of the conditions that put them at higher risk when they contract COVID are the same disparities that we've seen for many, many years. Hypertension, diabetes, obesity, heart disease, et cetera. We know that there have been years and years of differences or disparities between populations with those areas. So when they present with COVID-19 and they have all of these issues, these other pre-existing conditions going on, it puts them at a higher risk for poor outcomes with COVID-19, which means we're seeing a disproportionate number of deaths in the Black community and other minority communities as well. And we do know that many minorities are in those industries where they don't have the luxury like I have to work from home. They tend to be in service industry. So once they go there, they're putting themselves at much higher risk than others who have the ability to stay at home. So it's an important topic that we need to keep our eye on for certain.
Well, Dr. Green, we're out of time. Thank you so much for your time this morning. Please express from the Morning Blend our thanks to you and your team and all that you do in the community. We've been showing that phone number. I know you guys have a great website as well if people have more questions, but we just can't thank you enough, Dr. Green, for your time this morning. We really appreciate it.
Thank you so much for having me. Have a good day.
All right. Day well. We'll make sure to put this info on our website too.
All right. Bye-bye.
All right. We will be right back. Stay right there.